Good evening, Hamlin County. Please review the following information and contact Kelly Smith if you have any questions, and we will address those concerns in a future broadcast. Number 1, during a normal school year, many of our students will regress academically over the summer. This loss of academic skill creates a number of instructional challenges for us when we return back in the fall. We are even more concerned about this loss of academic skill this year because our students have not been in school since March. Currently, we are engaged in a number of activities to keep students academically engaged over the summer so we can minimize this loss of academic skill. One of the programs we have is the distribution of summer activity bags. The bags were primarily funded by donations from First Horizons banks and other generous individuals in our community. These summer activity bags include a number of instructional activities the students can complete while we are out of school. The material in these bags can't replace direct instruction in the classroom, but it is our hope that they can help to keep students meaningfully engaged in productive activities. These bags will be distributed during the week of June the 15th at our feeding program at East High School and the summer school program at West Elementary School. We will continue to distribute the bags until all the supplies are depleted. Number 2, although we're still dealing with many aspects of the COVID pandemic, it is good to take a little time to reflect on what we have accomplished over the last few months. The following is a brief summary of some of the things that various organizations and individuals have done for the community during this time. The school system prepared over 260,000 meals for our students since March. The school district buses drove nearly 3,500 miles this summer to deliver meals to those who didn't have transportation. The extended school program provided free child care for essential workers to ensure parents could go to work. It is estimated this was approximately $100,000 worth of free child care. The school district produced over 400,000 pages of supplemental instructional materials to help keep students engaged during the closure. The health department has conducted over 2,000 COVID tests since the outbreak, and they continue to conduct daily testing. They have sponsored 3 weekend testing events to provide greater services and convenience to individuals within our community who desire to be tested. The health department has also helped facilitate COVID testing in Hamlin County long-term care facilities. The health department has helped to distribute over 10,000 cloth face masks. The Virus Task Force has produced a daily broadcast during the first couple weeks of the pandemic to ensure that community members were informed about essential services and that everyone had access to reliable information. The task force has continued to broadcast this information weekly to keep our community informed. The task force created a survey to help community leaders better understand the needs of our community so that we could more effectively respond to the concerns of our citizens. The task force created an emergency operations center to deal with essential service if the pandemic overwhelmed our medical facilities, law enforcement, and first responders. Various agencies and individuals came forward to provide financial assistance with utility expenses. Daily Bread, Food on Foot, Central Services, and others have supplied countless meals to needy families during this time. Local ministers and pastors provided inspirational messages and offers of assistance to our community to help those who are struggling with stress and depression. First responders, healthcare providers, and law enforcement work daily and relentlessly in their efforts to ensure that the needs of our community were met. Clearly, the needs of the community were enormous during these challenging times, and it was impossible to address every individual need. However, we hope the community understands that community leaders were extremely focused on helping our citizens navigate through these difficult times and that we constantly look for ways to offer better assistance. Number 3, the task force administered a survey to help community leaders better understand the needs of our community. The following is a brief summary of the results of that survey. First, approximately 58% of the respondents indicated that the county leadership had done an exceptional job addressing the issues associated with the pandemic. About 37% stated that the county leadership had done a satisfactory job, and about 5% stated that the county leadership had not done a good job. Approximately 50% of the respondents indicated they were doing okay mentally and were not experiencing any serious emotional issues. About 41% stated they were doing okay but reported some mental and emotional concerns. About 8% indicated they were experiencing a significant amount of emotional and mental issues. Some of these respondents reported that they were really struggling with mental issues and that they needed some professional assistance. There were a number of responses concerning reopening the economy. Most individuals reported that they were concerned about the potential health risks to them and to their families when they had to return to work. A significant number of the respondents indicated it may be too early to reopen the economy, but others stated that we had to reopen the economy to prevent the state and individuals from losing so much money. Approximately 30% of the respondents stated that they were excited and ready to go back to work. Approximately 25% stated that they would go back to work, but had some reservations. About 9% stated that they would return if forced to do so, but had major reservations about returning to work. About 7% stated that they would not return to work because they had serious health concerns. About 20% of the respondents were still working full-time on site. About 14% were working full-time from home, and about 19% were working a combination of full-time from home and on site. About 22% reported being furloughed or laid off of work. About 44% indicated they were still working full-time and being paid full-time wages. About 12% indicated that they were not reporting to work but still being paid. The three major health questions that responders had centered on how do I know if I need to be tested, are workplaces going to be safe when I return, and how long should I be isolated if I think I've been infected. Another major health question was how would the virus impact me if I became infected. Nearly 57% stated that they were wearing masks when going outside, and about 90% stated that they were frequently disinfecting all personal items. Over 92% were washing their hands frequently, and 72% were avoiding crowds of more than 10 people. Most individuals reported they needed more information about how to receive financial assistance, how to secure food items, health care, child care while working, educational services for children, assistance with utility expenses, and reliable information about the virus and plans to reopen the economy. In some of the open-ended questions, respondents listed a variety of comments. Most of those comments involved concerns about returning to work in a safe manner. Many expressed a concern that they were working in an environment where social distancing would be extremely difficult to maintain. Several of the respondents wanted to be assured that specific safety protocols would be maintained when returning to work to ensure personal safety. The issue of having sufficient masks, taking temperatures, having gloves, and disinfectants in the workplace were common concerns. Many expressed a concern that others were not wearing masks when outside and that they were not practicing social distancing. There were a number of comments and concerns about how we would safely open schools in the fall. Many expressed concerns that it would be virtually impossible to social distance in a classroom and stated numerous apprehensions about sending children back to school and staff members returning to work in a school environment. Many expressed a concern that we were living with health-compromised family members who would be considered high risk of COVID. Conversely, there were some respondents who expressed a concern that the county had overreacted to the virus and that we needed to return back to work as soon as possible. Some expressed the desire to reopen the economy immediately before the entire state went broke. The information for this survey has been shared with county leadership, and we sincerely appreciate everyone who took the time to respond. We will use this information to help coordinate our efforts and to more effectively serve the needs of this county. We certainly do appreciate your attention to this broadcast, and we wish you the best. Thank you.